We're now going to hear from the representative from Quest Diagnostic, Dr. Fesco. Dr. Fesco is an oncologist, executive medical director, medical affairs of Quest Diagnostic. Dr. Fesco.
Thank you for having me. So we're going to talk a little bit about FIT testing, which is the product that we have at Quest Diagnostics, and we'll talk about its use. So again, why is colorectal screening important? We've gone over a lot of this, but in the US, there's 104,000 new cases of colorectal cancer expected in 2022. Unfortunately, 45,000 patients will die of the disease in 2022. And it's recommended at this point in time for ages 45 and over, based upon multiple national guidelines, which you can see listed. And it's the second leading cause of death. Next slide, please. There you go. So by 2030, the estimated projections of US cancer incidence, this group is growing. And in the age range of 20 to 49, we estimate that colorectal cancer will be the leading cause of death by 2030. Which is unfortunate and growing quickly. So the national guidelines, if you look at it, one of the big changes that we've seen in the US is that the American Cancer Society has recommended that both men and women of average risk of developing colorectal cancer begin screening at the age of 45. This is now a tier 1 recommendation for both men and women of average risk. This is a change from the age of 50 to 45. Based upon what we're seeing globally of an increase in the incidence and early presentation of colorectal cancer. Next slide. So what do we have at Quest? At Quest, for those of you who may be internationally, Quest is one of the largest labs in the United States. We've gone with something called InSure ONE, which is a FIT-based testing, which you heard, which basically picks up hemoglobin within the stool. It only picks up, however, human hemoglobin as opposed to animal. The instruction for use is basically we give a test card. It's got a brush, which you basically brush the water in the bowl. You don't actually have to touch the stool. And then it comes with a mailing envelope where it goes right back to the lab and is tested for the presence of hemoglobin. Next slide, please. So why did we sort of pick this? So if you look at it, if you use it in an annual screening method, which is what it is recommended, we have sensitivity that is in the 90+% range, which is very important. It balances the cost of testing and basically is able to pick patients up early when they may have intermittent bleeding. That may be a sign of either early colorectal cancer or an advanced stage adenoma, which is a precancerous lesion, where treatment is able to be curative. So it's patient-friendly in that there's no handling of the stool, which is one of the complaints that we get. There is high sensitivity and specificity. And we have fewer false positives as opposed to some of the other testing methods in that we only test for human hemoglobin within the stool. We can go on to the next slide. So again, it's a test code in the Quest test directory, 11290. It's easy to order within the US in our electronic database. And we have a full one-page question and answer on our website about the actual testing. Next slide, please. So again, we've gone through a lot of this, but the important thing to realize is that we're trying to catch the colon cancers early, either in a precancerous lesion or in a early, where there may be surgical options if it's a colon cancer, where you could resect the bowel and not have any chances or very low chance of any cancer being present outside of the removed section. And that's a partial colectomy. The other thing that can happen is if it is caught in later stages, the survival, as you can see there, goes down to 22% as opposed to 67% if it's early stage. And unfortunately, in the later stages, you have to undergo potentially chemotherapy. Sometimes radiation may be used, particularly if the cancer has spread and it is metastatic. And there can be targeted therapies which can be used, such as BRAF, KRAS, or immunotherapies are coming in. But the goal, again, of a cancer screening program is to prevent patients from ever needing that and to potentially get it at the point where it could be cured with either a colonoscopy or with a localized resection. Next slide, please. So the last thing I'll touch on is that at Quest, one of the things that we did notice over the pandemic is a massive decrease in the number of diagnoses that were made, that we published this in JAMA. And you may say, well, that's great. There were less cancer diagnoses during the pandemic. But one of the effects that we believe and we are now seeing is that it was not that people were not developing cancer. It is that people were not coming in for their screening programs. And so although we saw a massive decline in cancers, we're now making up for it on the back end of the pandemic, and with patients presenting with later stage disease because they were never screened. If we can go on to the next slide. So again, InSure ONE, it's basically a convenient, you basically just touch it to the toilet water, package it up in the packaging from the lab. It picks up whether or not there is the presence of hemoglobin within the stool. Again, it is not specific to say that this absolutely is cancer. However, that is one of the things that you would want to know because colon cancer is famous for having intermittent bleeding. And we can go on to the next slide, please. And if you have any questions, I'd be happy to answer. Thank you for having me.